Onika Stellingburg, a climate change negotiator and a climate change youth activist from Guyana, and it is my pleasure to make these few brief recommendations as it relates to policy changes that are essential and required within our region to help us to be resilient to the impacts of climate change on our health sector. One of the first and foremost recommendations that I must make is the integration of ICT within our data management and data collection systems. Our healthcare centers, our hospitals should move within the 21st century to match our clinic cards and our paper-based records with cloud-based health systems, so that should any disaster happen, it's much easier for us to bounce back, where patients can be able to access their records and access their healthcare information even the day after an event has happened, and we can provide to them the service that they require. Secondly, our ministry should work with other ministries. Our healthcare ministries should collaborate with other ministries within our countries to ensure that health implications are included in the design of any climate change intervention. If we're building a nature park, whatever is happening, we must build it so that we provide other support for persons who may need psychosocial help, for persons who may need to go into nature to help them to cope with what is happening. We also must increase the amount of research that we're doing within the sector so we can understand how climate change will impact our physical as well as our mental health. And finally, any disaster preparedness response or support should include psychosocial support for our young people and marginalized communities who are sometimes more adversely impacted by the changes that are happening in the community. Everybody deserves to have these changes, and as young people, we want to make our voices heard to ensure that these are some policy interventions that can be implemented. I thank you.